Namaste. Did we practice urine therapy before our birth? Well, that is the main big question. Actually, whenever new patients they do come to our campus for urine therapy treatment or for a naturopathy treatment, sometimes some people say that they will not practice urine therapy, they will undergo only naturopathy and yogic some modalities. For them, I do tell them that need not to keep any aversion against urine therapy. Already in their life, they have practiced urine therapy. When I say this, they really get confused because before our birth, we have already practiced urine therapy. This normal layman public, they doesn't know about it. Here, one of the most interesting point I want to share is that we all have practiced urine therapy before we were born. Do you know what is amniotic fluid? Well, a fetus floats in amniotic fluid which consists mainly of urine. In our mother's womb, this amniotic fluid we float in. The fetus drinks some of the fluid every day and urinates it out again. This cycle helps to build up the body and internal organs. Science has already discovered that fetuses in the womb use their amniotic fluid in order to develop their lungs. Fetus literally breathes this fluid into the lungs, and without this fluid, fetus lung cannot develop properly. The fetus's urine is the most important component of amniotic fluid in mother's womb. There is one research paper published in New York Times Medical Section August 16, 1988, which says urine is the main component of amniotic fluid. In that, the human fetus floats. Normally, the baby breathes this urine-filled amniotic fluid into its lungs. If the fetus urinary tract is blocked, the fetus does not produce this fluid, and without it, the lungs of the fetus do not develop. This is what the research paper talks about, which was published in New York Times Medical Journal. It has also been discovered that surgery carried out in the womb on the fetus does not leave any scar of that particular surgery. Amniotic fluid and specifically the urea in it, in which the fetus floats, ensures perfect healing of every wound within the womb. There is one book named as The Heart of Healing. The author name is William Poole. In his book, he describes how remarkably well the scars of the fetus which are operated upon are healed as if nothing has happened. Whereas after the birth, the same operations would have left big scars that would never completely disappear. Doctors were very surprised who discovered this, and according to William Poole, they are trying to find out the reason behind it, as they are looking for a method to help to heal post-operative scars on adults. Many of us must have heard or seen in remote villages, if they get any cut or burn on their bodies, they simply pee on them and get along to their work. And that's why we say urine is a best first aid antiseptic. Hopefully, sometimes in future, modern doctors will discover the very simple method of using patient's own urine for this purpose. Those people who are familiar with urine therapy know from their own experience how a urine-soaked pack used on the non-healing wounds can do wonders in healing those wounds. This is the fact probably none of us without a medical background know, but the reality is that the urine is absolutely vital to our body's functioning, and the internal and external application of urine have proven medical ramifications far beyond anything that we, the general public, can imagine. So don't think that you are new to the urine therapy. Already you have practiced before your birth in your mother's womb. Already you have drank your own urine. So don't keep any aversion. Start drinking and enjoy the health. Thank you.